Did you know that just 1 spoonful of cod liver oil per day can improve insulin sensitivity, reduce inflammation, and protect the heart? Or that a serving of beef liver provides enough vitamin B12 to prevent nerve damage and boost energy? If you have diabetes, you have probably heard plenty about cutting carbs, taking medication, and monitoring blood sugar. But here's something rarely discussed. A deficiency in essential vitamins can make diabetes much harder to control. Are you experiencing chronic fatigue, unexplained body aches, fluctuating blood sugar levels despite your best efforts? You might be lacking vitamin D, B12, or folate, 3 essential nutrients that help stabilize blood sugar, protect nerves, and maintain heart health. But wait, avoiding common mistakes in vitamin supplementation is crucial because the wrong approach can worsen your condition. In this video, we will not only cover the top 3 vitamins that diabetics need but also reveal the best natural food sources for maximum effectiveness, hidden foods that deplete vitamins without you realizing it, how to choose the right supplements to avoid wasting money on ineffective products. And don't forget, like, share, and comment if you find this video helpful. We will continue to bring you more valuable information to help you manage diabetes smartly and effectively. Let's dive in. 1. Vitamin D, the key to blood sugar stability and overall health. As mentioned earlier, a vitamin D deficiency not only affects general health but directly impacts blood sugar control in diabetics. Research shows that 70 to 90% of people with type 2 diabetes are deficient in vitamin D, an alarming statistic that highlights the importance of this vitamin in glucose metabolism. How vitamin D affects diabetes. Vitamin D plays a vital role in supporting pancreatic function, which is responsible for insulin production. A 2020 study published in Diabetes Care found that people with low vitamin D levels had a 33% higher risk of developing type 2 diabetes compared to those with adequate levels. This happens because vitamin D helps stimulate beta cells in the pancreas to produce insulin, improving insulin sensitivity and enhancing blood sugar control. Additionally, vitamin D helps reduce chronic inflammation, a major cause of insulin resistance. Studies from the Journal of Clinical Endocrinology and Metabolism indicate that proper vitamin D supplementation can lower C-reactive protein, CRP, levels, a marker of inflammation, by 30 to 50%, thereby improving blood sugar control and reducing diabetes complications. Signs of vitamin D deficiency. If you frequently experience fatigue, muscle pain, joint discomfort, slow wound healing, or tingling sensations in your hands and feet, you may be deficient in vitamin D. Studies also suggest that vitamin D levels below 30 nanograms per milliliter increase the risk of diabetes complications, including heart disease, kidney failure, and nerve damage. Best natural sources of vitamin D. Cod liver oil. 1 tablespoon provides 1.360 IU, 340% of the daily requirement. Wild-caught salmon 100 grams provides 570 IU, 130% of the daily requirement. Sun-exposed mushrooms 100 grams contains 200 to 400 IU of vitamin D. Egg yolks. 2 eggs provide 80 IU, 20% of the daily requirement. How to supplement vitamin D correctly. If you cannot get enough vitamin D from food, consider taking a supplement. According to Harvard T.H. Chan School of Public Health, the recommended dose for adults is 1.000 to 4.000 IU per day. Depending on individual health conditions, choose vitamin D3 over D2, as D3 is better absorbed by the body. Factors that reduce vitamin D absorption. Lack of sunlight exposure. Limited sun exposure reduces the body's ability to synthesize vitamin D. Poor diet. Consuming too much processed food and industrial vegetable oils, soybean oil, sunflower oil, can decrease vitamin D absorption. Magnesium deficiency. The body needs magnesium to activate vitamin D, so ensure you get enough from foods like almonds and leafy greens. Vitamin D improves insulin sensitivity, reduces inflammation, and protects nerves, the heart, and the immune system. To better control blood sugar, ensure you get enough vitamin D from diet, supplements, and adequate sunlight exposure. 2. Vitamin B12, the shield, for nerve protection and energy in diabetics. If you experience numbness, tingling, sharp pains, or chronic fatigue, You may be lacking vitamin B12 without realizing it. This is a common issue in diabetics, especially those taking metformin, a diabetes medication that interferes with vitamin B12 absorption. Why are diabetics at risk of vitamin B12 deficiency? Vitamin B12 is essential for nerve protection, red blood cell production, and energy metabolism. However, many diabetics suffer from long-term B12 deficiency because symptoms develop slowly and are often mistaken for diabetes complications. A 2021 study in the Journal of Clinical Endocrinology and Metabolism found that 30 to 40% of type 2 diabetics taking metformin long-term experience B12 deficiency. Metformin reduces B12 absorption, leading to gradual depletion over time. Additionally, diabetics often have reduced stomach acid production, which is necessary for B12 absorption. Signs of vitamin B12 deficiency. You may be lacking B12 if you experience tingling, numbness, or sharp pains in the hands and feet, a sign of nerve damage due to B12 deficiency. Chronic fatigue, dizziness, or pale skin due to B12-related anemia. Memory loss, forgetfulness, or lack of concentration, often mistaken for aging. Muscle weakness and balance problems caused by nerve damage. Benefits of vitamin B12 for diabetics. Proper B12 intake can help reduce nerve pain and neuropathy symptoms caused by diabetes. Boost energy levels and improve heart health by lowering homocysteine, a risk factor for stroke. Enhance brain function and reduce stress and depression. Promoting mental clarity. Best natural sources of vitamin B12. Beef liver 100 grams provides 3.500% of the daily requirement. Clams 100 grams contains 4.000% of the recommended daily intake. Scallops, sardines, and salmon 100 grams provides 200 to 350% of the daily B12 requirement. Eggs. 2 eggs provide 25% of the daily intake. How to supplement vitamin B12 correctly. If you struggle to absorb B12 from food, sublingual, under the tongue, tablets or B12 injections are effective alternatives. According to Harvard Medical School, the recommended dose for adults is 1.000 to 5.000 mcg per day. Depending on deficiency levels, factors that reduce vitamin B12 absorption, long-term use of metformin or acid-reducing medications, excessive alcohol consumption and processed food intake, high consumption of refined foods such as white bread and instant noodles. Vitamin B12 is crucial for diabetics, protecting the nervous system, boosting energy, and improving memory. If you experience fatigue, numbness, or cognitive decline, do not overlook B12 deficiency. Ensure you get enough from natural sources or high-quality supplements. 3. Folate, vitamin B9, the essential nutrient that diabetics overlook. Folate, also known as vitamin B9, plays a crucial role in red blood cell production, energy metabolism, and nerve function. However, many diabetics suffer from folate deficiency without realizing it. What's alarming is that a lack of folate can worsen diabetes complications, including nerve damage and increased stroke risk. Why are diabetics at high risk of folate deficiency? A study published in the American Journal of Clinical Nutrition found that nearly 40% of people with type 2 diabetes have undiagnosed folate deficiency. The main reasons include metformin side effects. This commonly used diabetes medication not only reduces vitamin B12 absorption but also affects folate levels, leading to a double deficiency. Increased excretion through urine. Diabetes causes frequent urination, which leads to a significant loss of vitamin B9, a water-soluble vitamin. Poor dietary intake. Many diabetics focus on controlling blood sugar but neglect essential vitamins in their daily diet. Serious consequences of folate deficiency. If you do not get enough folate, your cardiovascular system, nervous system, and energy levels can suffer. Here are some of the most concerning risks. Increased nerve damage risk. Folate deficiency slows down nerve cell repair, making diabetic neuropathy progress faster. Higher risk of stroke and heart disease. Folate lowers homocysteine levels, a compound linked to arterial plaque buildup and high blood pressure. A study in Circulation Journal found that folate deficiency increases stroke risk by 32% in diabetics. Cognitive impairment and depression. Vitamin B9 is essential for the production of serotonin and dopamine, neurotransmitters that regulate mood and memory. Anemia and chronic fatigue. Folate is crucial for red blood cell production. Deficiency can lead to anemia, persistent tiredness, and overall weakness. How to recognize folate deficiency. If you experience any of the following symptoms, your body may be lacking folate: chronic fatigue and pale skin, memory issues, difficulty concentrating, and brain fog, slow healing wounds, dizziness, headaches, or shortness of breath with activity. Best natural food sources of folate. To boost your folate intake, include these nutrient-rich foods in your diet. Beef liver 100 grams provides 140% of the daily folate requirement. Spinach, cooked, 100 grams supplies 65% of the daily folate requirement. Lentils, cooked, 100 grams contains 90% of the daily folate requirement. Asparagus 100 grams provides 35% of the daily folate requirement. Avocado, 1 medium avocado contains 25% of the daily folate requirement. How to supplement folate correctly. Getting folate from food is the best approach. However, for those with severe deficiencies or absorption issues, doctors may recommend supplements. Important note: avoid synthetic folic acid and instead opt for methylfolate, the active form of folate that the body can absorb and use more efficiently. Recommended daily intake, National Institutes of Health, NIH. Adults, 400 to 600 mcg per day. High-risk individuals, including diabetics on metformin, 800 to 1.000 mcg per day. Factors that reduce folate absorption. Long-term use of metformin or acid-reducing medications. Frequent alcohol consumption and poor diet. Excessive intake of refined foods, white bread, instant noodles, processed foods. Why folate matters for diabetics. Folate plays a crucial role in nerve protection, stroke prevention, heart health, and energy maintenance. It also supports brain function and mood stability. If you have diabetes and have not paid attention to folate, now is the time to reconsider. A small dietary change or the right supplementation can make a huge difference in your long-term health. Managing diabetes is more than just monitoring blood sugar. Effective diabetes management is not just about checking glucose levels or taking medication. It is about nourishing your body properly so it functions optimally. If you lack vitamin D-B12 and folate, you won't just feel fatigued, numb, or forgetful. You could also be accelerating the development of serious diabetes complications. Take control of your health today. If you have ever felt frustrated because your diet is healthy but your blood sugar remains unstable, consider whether you are missing these 3 essential vitamins. Even a small adjustment in nutrition can create a significant improvement in your health and quality of life. Share your experience. Have you ever experienced symptoms of vitamin deficiency? What are you currently doing to improve your health and nutrition? Drop your thoughts in the comments, and don't forget to watch our next video, where we will continue sharing science-backed, practical, and easy-to-apply information to help you manage diabetes effectively. See you in the next video.